Hi, it's Dr. Bishop from Animal Healthcare. Continuing on my video series on cat care. We went over in the last video a little bit about basic cat care and core vaccines, rabies and distemper, and touched base on feline leukemia. All cats should have at least annual physical exams. I would break cats out into two groups: older cats, and I usually figure 8 years old and older, and younger cats less than 8 years of age. For the younger cats, we want to do annual physicals just to find any issues that are there. Watch weight gain, weight loss, look for dental disease, look for ear disease. Obesity is a huge issue with cats. They tend to overeat and become very heavy. Intestinal parasite screening is super important because cats can carry worms that actually affect people. So intestinal parasite control is important. They go and bury their stool, but they never really wash their hands afterwards, or wash their paws afterwards. Intestinal parasite prevention. In the dog, we do heartworm prevention year-round. In the cat, we should do that as well to get the intestinal parasite control, and heartworm is a disease that finds its way into the house via mosquitoes. Flea and tick control. A lot of people say, well, my cat never goes outside, so fleas don't come in, but they don't think about the fact that the dog's bringing fleas in. There are diseases that are transmitted by fleas to cats, some of which are not terribly common yet, but are becoming more common, and those diseases can actually be lethal to cats, either by causing destruction of red blood cells or other issues. So flea and tick prevention year-round is helpful. There is some transmission of flea and tick diseases to people. People come up with Lyme disease, that comes from ticks, and prevention is really important. Dental care, another thing that cats do get dental disease. They do get tartar. Tartar needs to be removed. If it's not removed, we have problems, and they develop cavity-like lesions that are extremely painful and will result in the loss of the crown of the tooth, in other words, everything above the gum line. Older cats, cats over 8 years of age, I recommend physical exams every 6 months. We should do blood testing, including thyroid testing, on a yearly basis. We're looking for kidney and liver disease and thyroid disease and anemia and all those sorts of things. Urine screening always is a good idea anytime we're doing blood work, because urine holds data that we cannot get from the blood. And older cats do get blood pressure issues. Blood pressure can be a real problem in cats. It can cause sudden blindness because of retinal detachment. So if we have a situation where we have overactive thyroid disease because of a thyroid tumor, which is quite common in older cats, we will get hypertension and sudden blindness. So if you have questions, feel free to give us a call here at Animal Healthcare. Our number is 630-305-7200, and we'll help you out with those questions. Thank you for listening.